Thank you very much. I should confess from the very beginning that I probably never would have gotten out of college if it had not been for your president. She had a wonderful way of calling me and saying, "Andrew, you know we have this examination tomorrow. Why don't you come over and help me study?" And she never let it be known that she carried me through school. But if you all let her carry you as she carried me, the future for you is unlimited. I should introduce also my brother, Dr. Walter Young. Where are you? He became the dentist in our family, and Miss Katara Kelly, who is on our staff at the Andrew Young Foundation. When she accepted the job, told me she would only be there 1 year because she expected to go to Meharry to medical school. And I said, well, why not Morehouse and Howard? Or Howard. And she gave me a half-hour lecture, which made sense. But I should also say that our families have been linked really since our parents, my father and Dr. Epps' father, were students at Howard University together, and we really and truly grew up together. My father was a good churchman, but when I decided to be a minister, he said, "You're going to have to do that on your own." He said, "All of the ministers I know are either poor or crooked, and I don't want you to be either. And so if you're going to try that route, you're on your own. I'm not going to waste my money on divinity school." But he never gave up on that, because when I was very proud that Thurgood Marshall, as Supreme Court Justice, was swearing me in as ambassador to the United Nations, he knew my father from younger days in the NAACP, and he said to my father, "You must be really proud of this boy." And his answer was, if he'd have been a dentist, he'd have been somebody. So you know that I'm grounded in dentistry, and before I forget it, I want to ask say one thing about dentistry. That when I became mayor, we had the worst zoo in the world, in the United States, and we either had to close it down or privatize it. We finally privatized it. We ended up in about 5 years with one of the top 10 zoos. And so I spent a lot of time dealing with these big animals. And one day I said, how do you keep these elephants and lions and tigers healthy? And they said, the only thing we do is twice a year, we put them to sleep and clean their teeth. And they said, we have found that the best method of health maintenance is clean teeth. Now, why in the hell did you all not raise enough hell to get one sentence about dentistry put in the Affordable Health Care Act? Now, it's not too late. In fact, it's really just beginning. The fun hadn't started yet. Nobody ever thought that President Obama could get that thing passed. And then when he got it passed, they never thought that he could get reelected. And he's done that, and they can't figure out what to do next. But they're trying to rewrite the Constitution to keep people from being healthy for some reason or other. I don't understand it. I said to one of the congressmen, to one of the reporters, and I slipped out and said it, but I'll say it publicly now. This is probably the dumbest Congress I've ever seen. Here we are trying to lead the world, and we have to lead the world. When I went to Congress, almost everybody there had been in the Second World War, the Korean War. They were Rhodes Scholars. They were experts in all kinds of fields. And we understood that it was a holy trust to be elected as a member of the Congress of the United States. And we understood that as a global responsibility, that what Martin Luther King said, injustice anywhere is a threat to justice anywhere. So we made it our business to see to it that Russia learned to respect human rights, that Israel's security was secure, that South Africa could find a way to come out of apartheid without bloodshed, that the Berlin Wall could come down without atomic warfare. And everything and every question we raised was a life or death question, not only for ourselves, but for humanity. I would say the same is true today. That if the United States goes bankrupt, or say it does not pay its bills on time. Now I know you all don't know about that. The next time you go back, they have added a point to your credit, and instead of a 6.5% mortgage, you got a 7 or 8% mortgage. Haven't they realized that if we don't pay our bills on time, China holds our debt? You got our enemies then saying legitimately, let's raise the interest 1 percentage point, and that'll really throw us into a deficit. If we want to get out of a deficit, let's pay our bills on time, let's get our Congress together, let's move our nation forward, and let's let people realize that we are the only people on the face of this earth. Not that we're so special, though we are, but we're special because we have stolen the best of everybody in the world. You know, just looking right down this row here, there's 75 countries represented in the I'm not talking about you all only. I'm talking about if we decide who we are by who our grandparents were, and count the 4 grandparents on each side, you know, everybody in the world is in this room. Whether it's legal, illegal, or it doesn't make any difference, but the fact that we're here means that there's something special. And it means that to those who much has been given, of them will much be required. And so I'm here to challenge you today and try not to take too long. I first got discouraged with medicine when I read a book called The Cry and the Covenant. And the problem was, in the midst of the bubonic plague, doctors were going from the autopsy room to the delivery room and weren't washing their hands. And this doctor said, you know, you have to wash your hands. You can't take the germs. They didn't know about germs back then, and the bubonic plague period. And doctors were held in such esteem that only nurses and midwives had to wash their hands. And they were special. In order to get his colleagues to wash their hands, he got put out of the medical society, he got divorced, he lost his job, and he finally shut himself up in an operating room with a cadaver that was infected, cut himself, and allowed himself to be infected, and locked himself in, and gave his life to get doctors to wash their hands. Now, it's going to be almost that hard to bring about change in this day and age. And yet, change is absolutely essential and necessary. That we are going to have to find not only ways to heal people when they're sick, but we're going to have to find, it's really too expensive. We're going to have to find ways to keep people well. Now, because I worked around Africa a long time and spent a lot of time with waterborne diseases, I realized that there are 50 to 70 diseases that really can be cured with clean water. And so instead of inventing cures and looking for cures for all of these various diseases, I wonder why Bill Gates and Warren Buffett and others don't just set up some water purification plants that would pay for themselves. And I'm saying we've got to find other ways to do it. But then I realized that drinking water is very important for us too. I don't like to talk about health disparities, forgive me, because my father-in-law lived to 91, and the only time that he set foot in a hospital was when they took him there to pronounce him dead. And he drank plenty of water. He worked every day of his life. He never smoked, didn't drink but a little bit every now and then on special occasions, and by and large ate healthy food that he grew in his own garden. And I'm saying that it's that our responsibility, our first responsibility, is not to get people well, but to keep them from getting sick. And we can do that and make it more and more affordable so that when those of us who can't find ways to stay well, you'll be able to help us get well. And that's, it seems to me, the summary of the challenge of the Affordable Care Act. Now, everybody says it's going to cost too much. It's going to cost too much if we do what we've been doing all along. But, a bunch of doctors came to me from Seattle. Not that Grey's Anatomy Seattle group. They have decided that that there's good money in taking care of senior citizens. And so they signed up anybody that was 65 and had a Medicare card. They would sign them up and guarantee them health. And their mathematics, though I couldn't check it, but what they said to me was that it cost the government $71,000 a year to take care of a Medicaid patient. They could take care of a Medicaid patient for $25,000 a year if they saw them regularly and had regular visits, if they gave them their shots and their immunizations on time, if when they were sick, they didn't wait till they needed to go to the hospital, they had outpatient services or even home visitation services. And that they had developed this model and it was working well in Seattle and they were moving it to Detroit. I said, now if you want to put something to the test, take it to Detroit. And I said, we could probably make this work in Atlanta. They said no, and I understand that they've built a facility in Detroit. And they said it's kind of like a Ritz-Carlton quality. And it's first-class facilities for the poorest of the poor in Detroit. And they believe that they can keep people well longer and make money doing it by introducing a new model of medicine for senior citizens. Now, you're studying medicine, and you have to know your medicine, and you have to have your scientific basis for everything and anything you do. But you can never be unmindful of the politics and the economics, because those are the things that will put you in boxes that will make it very difficult for you to practice the medicine that you've learned here. So you've got to be politically astute. You've got to be sensitive. And when I first went to Congress, the only time people ever kind of booed me and walked out of a meeting was up in North Fulton County, where there were no black doctors, and they weren't that comfortable with me as their congressman. But I went to speak to the North Fulton County Medical Association in 1974, and I said that everybody is coming to see me about health care and about health insurance. And I said, there's going to be something happen. I said, but the labor unions come to see me, the insurance companies come to see me, the pharmaceutical companies come to see me, but no doctors come to see me. I said, now I come from a family of physicians and grew up around. In fact, my first job, I think, was mopping floors in Flint Goodrich Hospital. And I said, somebody ought to be speaking for the doctors. Now, this was 1974. And a group of doctors got up and walked out of the room. They didn't even want to think about the possibility of changes in the delivery of health care. And so I think that you've got to realize that your congresspersons, your president, has got to have an input. In fact, it'd be good if you made it your point to volunteer to check your congressman's blood pressure every now and then. Make a call on him and check up on his health, so that you have a relationship there that he will feel that he can ask you questions in an unthreatened way about how he can represent you and the practice of medicine in his decisions in the Congress. And the Affordable Care Act is 2,900 pages, and I guarantee you there's nobody in the Congress that's ever read it. We read it at Georgia State University, not me, but a lot of the PhD students, and have discussed it. And there's a lot of room for error, but there's even more room for opportunity. And so we are engaged in the transformation of the world, not just the transformation of medicine. Banking has been transformed. Telecommunications has been transformed. Automobiles don't run the same way. I could fix an automobile 10 years ago. Now it's all electronic. My children can fix it, or my grandchildren will be able to fix them, but I couldn't. And that's the way things are going. I tell people nowadays, you minor in biology and chemistry, but if you got some time, take some engineering, because almost everything that's going to be happening in medicine is going to be laser driven and all of that kind of stuff that maybe we haven't gotten to yet. So I recommend kids that if you want to be a doctor today, go to engineering school first. And biology, you can almost pick that up on your own. But I have to say that because that's what I got my major in. And if it had been difficult, I probably wouldn't have gotten through. But anyway, not making light of this, but we've just got to rethink everything about our health and about our sanity. This morning, I saw that they have something for migraine on the news, some new little wire that they run up into your head. Well, I had sick migraines all my life until, as mayor, I went to China. And it was a 4-day trip, and I got off the plane and I said, I'm not going to make it. I said, one of these migraines is coming on, and if I don't if I don't find some way, this is a wasted trip because I'll be out for 3 or 4 days. And they said, you mind if our doctors treat you? And I had read that James Reston of the New York Times, who went to China with Nixon, had a ruptured appendix while he was there, and they removed his appendix and didn't put him to sleep. And he was able to, using these little needles in proper places, they opened him up and he could look at himself being operated on in the reflection, and then he wrote about it in the New York Times. This was back in 75, 74, no, yeah, 74, 75 when Nixon went to China. And so this was now 84, and I figured if they were doing that well then, they couldn't do me much harm with a headache. Well, they started putting needles in me and checking my pulse and all kinds of, about 10 doctors feeling on me. But when they got through sticking those needles in me and going off for a minute and came back and took them out, that was 1984. And I haven't had one of those sick headaches since. Now, I'm not a communist. And I wouldn't have minded if they had sent me a bill. But I don't need to know, I'm not sure that we need all of that electronic gizmo to do what they've been doing for 6,000 years. I'm saying, let's just be open. I was in Africa in the middle of when the AIDS outbreak came. And I said that AIDS didn't just start here. It's probably been here a long time, and folk haven't been dying before. And we had a big convention, and everybody was very pessimistic about Africa back in those days. And I said, you know, my church says, hell hath no horror. I mean, that heaven cannot cure. And I said, I'm sure if there's a disease on this